How you guys doing today? My name is Joe. Today I will be doing a skull series, and including the skull series will be a lateral, a Towns, Caldwell, and MSD. First, I will be descending my tube to 40 inches SID, which I will now do. And I have a 10 by 12 IR crosswise. So now that I set up my room, I will get my patient. Hello, Ms. Jones?
Oh, yes,
How you
hi.
doing? Hi, Ms. Jones. My name is Joe. I will be taking your x-rays today. But first, could I have your full name, please?
It's Judith Jones.
And can I have your date of birth also?
Yeah, 9/28/2002.
Perfect. Is there any chance of pregnancy?
No.
No? Okay. So what exactly happened?
I was at cheerleading practice and they didn't catch me. And I fell and I hurt my head.
Oh, I'm sorry to hear that.
Yeah.
Alrighty. So before I start, I'm gonna have you, if you have anything in your hair, any dentures, partials, hearing aids, I'll have you take that out because it'll show up in the
Yeah, I don't
X-ray.
have anything.
Okay, perfect. So for the first image, I'm gonna have you take a seat right here, please.
Okay.
Perfect. So now we'll begin my lateral skull projection. When doing my lateral skull projection, I'm making sure that I have my IR in it, 10 by 12 orientation. I have already set my technique to 85 kV, and it could be from about 6 to 8 mass. Now, I will cover my patient with the lip. You can hold that, please. I have my patient in an alley O position with a left marker to indicate that her left side is against the wall bookie. Now the mid-sagittal plane will be parallel to the IR. The IOML is perpendicular to the front edge of the IR, and also the interpupillary line is perpendicular to the IR, which I will be doing now, making sure. And I want to make sure that the central ray is 2 inches above the EAN. So I'm just moving the hair slightly to make sure that the patient is in the correct orientation, which she is. I will now take the x-ray. Do not move, please. Don't breathe. X-ray. Go ahead and breathe. So for my next image, I'm gonna have my PA axial Caldwell, and for this, I'll have my tube at a 15-degree caudate angle. And for the image also, it's gonna be about 85 kbp, 14 to 16 mass. I have my plate at a lengthwise orientation. Also, I have lead already on my patient. And when positioning my patient, you want to know that the OML is perpendicular to the IR, and the MSP is perpendicular to the IR also. So now I will position that, and then I was making sure that my central ray is going to exit through the nasion. The patient nose is centered at the center of the bucky. So I will position. Alright, I have my marker on the right side. I will now take the x-ray. Hold your breath, don't breathe. X-ray. Alright, for my next image, I'm going to do an AP axial town. And for my AP axial town, I'm going to position my patient. And when positioning my patient, I'm making sure that the MSP is perpendicular to the IR. Also, the OML is perpendicular to the IR. And also that there's going to be light above her head. So this, like I said, the central ray will be about 30 degrees caudate, and it's gonna angle about 2.5 inches above the glabella. I have a 10 by 12 IR and a lengthwise orientation. Patient has lead currently. I have a left marker on the left side to indicate where she's at. So now that making sure that the patient is properly positioned, so I will position her. So I have my patient position. Alrighty, don't breathe. X-ray. Now for my final image, I'll be doing a SMV, which is the Schuler method. And for this image, I will be making sure that the central ray is perpendicular to the IOML. It will be entering the mid-sagittal plane of the throat between the gonian and passes through the point about 3/4 inch anterior to the EAM. Also, the IOML will be parallel to the IR, and then the mid-sagittal plane will be perpendicular to the IR. I have my 10x12 IR. It is in a lengthwise orientation. My technique today will be 85 at 28 to 32 mass. So I'll be leaning your head back, please. Slightly this way. Just okay, stay like that, don't move, don't breathe. X-ray. After taking my images, I will now evaluate my lateral skull projection. When evaluating my lateral projection, I'm always making sure that there's proper collimation. I want to see entire cranium without rotation or tilt, and that there's superimposed orbital roofs and greater sphenoids seen. Also that the superimposed mastoid regions and EAM, and that there is superimposition of the TMJs. You want to make sure that the cell turcica is seen in profile. Also, the radiographic penetration of the parietal region is reached, and that there's no overlap of the C-spine by the mandible. All criteria is present, which makes it okay. The next image that I'll evaluate is my PA axial skull Caldwell method. And when evaluating this image, I'm looking for proper collimation. I want to make sure that the entire cranial perimeter is showing 3 distinct tables of the squamous bone. Also, that there's equal distance from the lateral border of the skull to the lateral border of the orbit on both sides. You want to make sure that there's symmetric petrous regions. Also, the petrous pyramids lying in lower third of the orbit with a caudal CR angulation of 15 degrees and filling the orbits with 0 degree central ray angulation. Always making sure that the penetration of the frontal bone is without excessive density and lateral borders of the skull. Everything is seen in this image and it is deemed okay. So now the next image that I will critique is the AP axial skull Towns method. When evaluating this image, also is the evidence of proper collimation, making sure that the equal distance from lateral border of the skull to lateral margin of the foramen magnum on both sides, indicating no rotation. Also that there is symmetric petrous pyramids, that the dorsum sala and posterior clinoids processes are visible within the foramen magnum. Also that the penetration of the occipital bone without excessive density at lateral borders of the skull is seen. The image contains all of the evaluation criteria and is deemed acceptable. So now the last image that I will critique is the SMV skull Schuler method. When critiquing or evaluating this specific images, you always want to make sure that there's proper collimation. You want to make sure that there's the structures of the cranial base are clearly seen and that they are indicated by adequate penetration. Also, that there's equal distance from the lateral border of the skull to the mandibular condyles on both sides, indicating no tilt. That there is superimposition of mental protuberance over the anterior frontal bone, which indicates the full extension of the neck. Also, that the mandibular condyles are anterior to the petrous pyramids and that there is a symmetric petrosa. All is present in this image, which is so now it is deemed acceptable, and this will conclude the evaluation of my skull images.